cranial nerves. Now, cranial nerves are, well, nerves that originate from the brain and they control the movement of your head, neck and your senses. So I've just have this really small diagram here that shows the third cranial nerve. Just right there, that's the third cranial nerve, okay? Yes, I'll set that down. But there's loads of them and they're all in different places. So to start with, we're going to test cranial nerve 1. I'm going to grab some gloves, I think, before we begin. And when you covered each of your nostrils, you got it correct again. And the second one was coffee, which is quite a strong smell and very familiar. So you got both those right, so well done. So for cranial nerve test 1, you've passed the olfactory test. So the next test is cranial nerve test 2. So this is the optic nerve, which is your sense of sight. So we're going to begin with a good old-fashioned Snellen chart test. So I've got my Snellen chart right here. The good old-fashioned different letters. So let's just start from the top and work our way down. So can you tell me what this letter is, my darling? Yes, indeed, it would be an E. E. What about this line? What letter do we have here? Yes, we've got an F and a P. Now the third line, my darling. What do we have here? Yes, that's a T. T. And these two. Yes, that's an O and a C. Now moving on down. What do we have here? It's an L indeed. P. It's an E. And we have a T. Now it's going to get slightly more difficult, my darling, okay? Just try your hardest and let's see how we do. So here we have a P. Yes, that's absolutely correct. And we have a E. Well done. Now what do we have here? A C. Well done, well done. An F. Excellent. And a D. Now moving on down, it's still moderately okay, but could start to get difficult for some people, so let's see. So we've got an E, a D, an F, yes, a C. Now what do we have here? C. And what would this small one be? A P. Well done, my darling. Okay, right. I've already lost track of where we were, to be honest. Here. Okay. Now, so can you tell me what that is? Okay, yeah. That one. This one. Okay. That one. Right, okay. This one. Okay. That one. Right, yes. And that one. Okay. Not too bad, not too bad. Now let's move on down to here. This one is going to be extremely difficult, I believe. So, you tell me what that is. Right, okay. focus on my nose and tell me when you can see my fingers come into view. Okay. And again. Yeah. Right. So next we're going to repeat that, but we're going to do it with each eye. So if you can cover one eye first, then we'll do the next, if that's okay. Perfect, okay. Just excuse me a moment. Right, so if you cover one eye for me. Perfect. And just tell me when you see my fingers come into view. Okay, excellent. And keep that same eye covered. We're going to do it from all angles. Yep, okay. And again, just from the bottom left corner here. Good, and just okay. And one last time. Okay, now you can uncover that eye and cover the opposite one, please. Excellent, okay. And again, just tell me when you see my finger come into view. Okay, yeah. And again, just tell me when you see my fingers. Perfect. And again, it's a bit repetitive, I know, my darling. There we go. We just have to test all the quadrants. Perfect. Okay. Right. Perfect. Just taking notes on my clipboard here as we go along. Now, the next test is cranial nerve test 3, 4 and 6. So the cranial nerve 3 is the one I showed you earlier at the start of our appointment. The one that's connected to the back of your eyes there. So this is the Oculomotor, Trochlear and the sense test. And you might have noticed you missed cranial nerve test 5, but don't worry, we will absolutely be coming back to that. So, I'm going to get my little pen light and we're just going to test your eyes with some bright lights, so bear with me a moment. Here we go. Okay. So, definitely works. So just going to look in both your eyes to start with. Bright light, just relax, just keep focusing on my nose. Okay. And again, just focus on my nose. Just looking in each one of your eyes. Perfect, okay. So next I'm going to test your pupil constriction when it reacts to the light. So I need you to cover an eye again, please. And I will look in the opposite one. Right. Just cover one eye. And I'm going to get you to look at my ear with the one that's open. Just look into my ear. Okay, look at my ear. Very good, very good. Excellent job, my darling. And the other side, just uncover that eye, uncover the opposite one, and just focus on my ear, okay? Okay, okay, muscles are working correctly. Excellent, okay. And we'll do side to side. Okay, yes, keep following, excellent. Wonderful. Now, I'm going to do that again, but with one eye at a time, okay? So you cover one eye, and using the one that is open, can you see my fingers? Excellent, okay, just follow them again, like so. Up and down. Side to side, testing cranial nerve 6. And cranial nerve 4 is up and down. And the rest is controlled by 3. Most of your eye. Going a bit fast, I apologize. Okay, now uncover that eye and cover the opposite one and do that all over again. Right, yes, just follow my finger, okay, my darling. Up and down. From the side. Yes, excellent. And up from the bottom, just following my fingers. Excellent. also have a little brush which I'll grab, and essentially what I'm going to get you to do is close both your eyes and tell me if it's soft, which would be the makeup brush, or dull, which would be this pen, okay? And we're just essentially seeing if your nerves in your face can essentially tell the difference between dull or soft, okay? Hold on a minute whilst I grab the makeup brush. Okay, so this is my handy makeup brush. Well, not really makeup brush at all, my handy, let's say, doctor's brush. It also has this strange thing on the end, which I have no idea what it does. I believe. So, anyway, that's the little brush part. As you can see, it's very soft. Okay, so I'll just get you to close both your eyes for me, my darling. Yes, just like that. And can you tell me if this is soft or dull? Absolutely correct, it is soft. Now tell me if this is soft or dull. Okay, okay. And what about this? Yep, absolutely correct. And this. obviously we did cranial nerve test 6 before 5, so that's why we've skipped 6. So this is the facial expressions and taste test. So just a couple of silly little tests just to check everything is still in working order. So can you raise your eyebrows for me to start with? Just raise them up and down like so. Excellent. And I want you to smile. Just like that. Oh, you've got a stunning smile. Lights up the room. Now, can you frown? Just like so. Well done. Now turn that frown back upside down. I like the smile better. Excellent. And can you puff out your cheeks like a puffer fish? Just like that. Excellent. And again, puff out your cheeks. Okay, perfect. And lastly, close your eyes tight as you can, like so. And keep them closed. I'm just going to see, can you see this light with your eyes closed? Can you see that bright light through your eyelids? Excellent, okay. Now, for your taste, have you noticed any changes in your taste buds recently? No change, that's excellent. Okay. Perfect. Okay. So, the next test is one of my favourites, is cranial nerve test 8, which is the Vestibulocochlear, which is just a very fancy word for hearing. So, I've got my tuning fork here. I've got 2 different ones. I've got a 512 hertz and a 128 hertz. So there's one slightly smaller than the other, so we're going to test them both. So we're going to start with the Rennie test. Okay, so for the Rennie test, I am just going to put this, I'm going to strike it and pop it to the side just next to your ear, if that's okay. Right, striking it now. Now just tell me when you can no longer hear it. Okay, I'm going to do the same again, but with the 512 hertz one. It's very different sounds. Okay, perfect. And the other side, I'm just going to strike it at the left side. Excellent. And this one. Now for the next test, we're just going to strike it in front of you, and I just want you to tell me if it sounds equal in both ears, okay? Right, we'll go ahead and get on with that. Right, just striking it. Now, can you tell me, does that sound clear and equal in both your ears? Okay, it does. That is what we like to hear. Right, if you bear with me a moment, I'll just pop my tuning forks away and right, just sticking this away. Popping it in this little protective bag. Excellent. as it should be. So I'm going to ask you to swallow just so I can check your throat if that's okay. So I'm just going to touch your throat there, and then if you can swallow for me, I'll just feel like perfect. Now cranial nerve test 10 is the vagus nerve test, which is your voice. Now I'm going to, for this test, get my colour blindness book out again and just want you to say what you see, okay? I'm just checking for any hoarseness in your voice or anything. So let's pick some easy ones. Right. Is there anything easy in this book? Not really. Right, tell me which number this is. 9. Excellent, excellent. Tell me what item this is. It's a car, quite right. And what animal is this? Yes, it's a swan. Okay. Now the next cranial nerve test is the accessory test, which is cranial nerve test 11. This is just simply testing your shoulder and neck muscles. So all I want you to do is shrug your shoulders and just push against me. Like, yes, just like that. Up and down, just. Okay. Right. Now I want you to look to the side. Just follow my finger with your head. Okay. And again, follow to this side. Okay. Very good. Now can you look up as far as you can? And down. Okay. Now the last test is cranial nerve test 12, which is the hypoglossal test, which just means tongue movement. So this is a straightforward, simple, straight to the point test. Just stick out your tongue and wiggle it around. Like that. Okay, just a tiny bit slower there. Perfect, okay. Well, let me just quickly review my notes. So, as far as I can see, you have passed every test with flying colours. I see absolutely nothing that we should be worried about. So you should be very proud of yourself. Now, so before we conclude our appointment, I'm going to take my gloves off. Right, well, that's my gloves off. And thank you for coming to your appointment today. It's been lovely to see you. And I hope we see you again soon. You can book another regular cranial nerve exam with my secretary